Today we'll be talking about diabetes, what it is, signs and symptoms of it, how it's diagnosed, why it needs to be treated, what problems it causes in your body, the risk factors for it, treatment for it, what doctors may recommend, lifestyle changes that you can make at home, and things that you can do to help prevent some of the complications of diabetes. We'll also be talking about hypoglycemia, or when your blood sugar goes too low, and what causes that and what you can do about that. What is diabetes? Diabetes is when your blood has too much sugar in it. We eat sugar every day. You may be eating it and not even knowing that you are. Oftentimes we think about eating sugar when we think about things that we add sugar in, such as desserts or soda, juice, things like that. However, sugar is naturally found in many foods. Fruits and vegetables have sugar in it, breads, rice, and even milk has sugar in it. There are many types of diabetes. There's diabetes type 1, type 2, there's pre-diabetes, gestational diabetes. Pre-diabetes, we won't talk about that today, but that's when your blood sugar levels, when they check those, are higher than normal, but they aren't at the diabetic range. Gestational diabetes can occur during pregnancy. It does put the person at increased risk for developing type 2 diabetes, which we're talking about today, later in life, and so they need to be checked regularly for that. However, we won't be discussing that today. That will be in a future talk. Today we'll be talking about type 2 diabetes. But before we go into what that is, let's understand a little bit about how the body works so we understand what causes diabetes. Normally, the body has a way of processing sugar so that the sugar level doesn't get high. However, when that process doesn't work, people can develop diabetes. So let's talk about what causes people to develop diabetes. Here's another one of my beautiful pictures. So every time you eat, your stomach breaks down your food into smaller particles. One of those particles is glucose, or what we'll be referring to as sugar in this talk, and what people commonly think of as sugar. When your stomach breaks down your food, glucose enters the bloodstream. Your pancreas gets an alert that says it needs to start producing insulin. So your insulin goes into the blood vessel, and it finds the glucose particles, binds with them, and helps remove them from the blood vessel. And then it takes it into the cells, where the cells use the glucose for energy. Glucose, or sugar in itself, is not bad. It is the energy source for our cells. However, too much glucose, or glucose not in the right places, is what causes problems. What happens in type 1 diabetes is that there's less insulin that's produced in the pancreas. And because of that, there's less insulin that goes into the bloodstream, and less glucose is absorbed and goes into the cells. So more glucose is left in the blood vessels. For comparison, in a person with a normally functioning pancreas, you'd have more insulin and hence more sugar that goes into the cells, versus this, where there's less sugar that goes into the cells because there's less insulin. In type 2 diabetes, your pancreas is still producing insulin in the correct amounts. However, your body is resistant to the insulin, and hence then the net effect is the same. You have less glucose going into the cells and more left in the bloodstream. And if that wasn't clear already, here's what it looks like. This is what you want your blood vessel to look like. This is what it looks like in diabetes. Now you may ask, why is that a bad thing? Like I said, the glucose is used as the energy source for our body. However, when it doesn't come to our cells and stays in our blood vessels, it causes problems. It causes damage to different organs that are very important to keep us alive and to keep us healthy. Here's a quick diagram to show you what diabetes affects. It affects our brain, it affects our eyes, it affects our heart, it affects our kidneys, and it affects the nerves that we have. Let's look at these effects in more detail. It affects the brain. Why is that a problem? Because the brain is one of the most important organs that we have. It controls almost everything that we do. Speaking, seeing, hearing, moving, feeling. Our thoughts are all processed in our brain, and if our brain isn't functioning properly, then we won't be able to do some or all of these things. So the problem with diabetes is it causes us to have strokes. When strokes happen, that damages part of our brain, sometimes irreversibly. Diabetes affects the heart. Why is that bad? So our heart is what provides blood to the rest of our body, and the blood is what provides oxygen to the rest of the body. Without the blood and oxygen supply, our organs will die. When people have diabetes, they're more prone to having heart attacks. And heart attacks, as you know, can kill you. Diabetes affects our kidneys. What are our kidneys used for? Well, they're very important organs that you don't really hear or talk about a lot. They're used to filter out the excess that our body doesn't need. Urine is formed by the kidneys. If the kidneys aren't working right, we build up many things in our body that can be harmful to us and ultimately kill us. So kidney damage caused by diabetes can lead to kidney failure, dialysis, and death. Our eyes. What are our eyes used for? I think I don't need to explain that. But with diabetes, unfortunately, you can become blind. The damage to the blood vessels in the retina can cause you to have vision loss in spots or complete damage over time. It not only damages the blood vessels of your eyes, it increases your chances of getting glaucoma and cataracts. Now let's talk about the nerves. What are nerves used for? Well, they're used for feeling. You may have heard in diabetes that people lose their limbs. Why is that? Oftentimes it's because they have lost sensation. And so when you lose sensation, you often can't tell that you have injured a part of your body and you don't check it and take care of it. If you don't check it and take care of it early, then it can become infected. And if it becomes infected enough, sometimes there's a need for an amputation. And so that's what happens to people. Oftentimes they'll get injured under their foot and they won't realize it because they can't feel. And so then the infection grows so big that they eventually need to have their foot or part of their foot amputated. And if things like that keep happening, they'll need amputations that go higher and higher and higher in their body. What are the risk factors of diabetes? Being older than 45, having a family history of diabetes, especially a parent or sibling with diabetes, being overweight or obese, having a sedentary lifestyle. What does that mean? It's one where you're just kind of sitting most of the time and you aren't moving or doing any activity. There's certain ethnic groups that are more at risk of having diabetes as well. These include Native Americans, Hispanics and Latinos, Blacks, Asians. What are the symptoms of diabetes? Unfortunately, many people go undiagnosed with diabetes for many, many years because many people don't have a lot of symptoms, or if they do, they're so minor that they don't realize that there's anything wrong. Here's a list of some symptoms that you may have, and if you do, you might consider going to the doctor and having things checked out. Increased thirst or dry mouth. This is caused by the increased sugar levels causing you to become dehydrated. Frequent urination. Again, the increased sugar makes you urinate more. Increased appetite. Because your body isn't responding correctly to the insulin in your body, there's not enough glucose going into your cells to provide your body the energy that it needs, and therefore it has an increased appetite to try to get you to eat more glucose to provide energy to the cells. You can have weight loss or weight gain. So the weight loss is caused because there isn't enough glucose going to your cells, and so your body starts breaking down fat and muscle. The weight gain is caused by the increased appetite you might be experiencing. Fatigue and irritability. If your body isn't getting enough of the glucose that it needs into the cells, then it will feel fatigued or tired because it's not getting the energy requirement it needs to operate properly. Also, if you have increased urination and you're getting up many times to use the restroom at night, that will cause you not to sleep as well, and you'll be more tired during the day. Blurry vision. So the increased glucose in your blood vessels can cause the lenses of your eyes to swell temporarily, and that can cause the blurry vision that you experience. Slower healing. Increased glucose causes poor circulation, which in turn then slows down the healing process. The slow healing process causes an increased chance of infection. Yeast infections. The high sugar content or the high glucose content in your blood provides an environment that's ideal for yeast or fungus to grow. Sexual dysfunction in males. The high blood sugar causes men to have decreased libido as well as erectile dysfunction due to the injury it causes in the blood vessels and nerves. Sometimes people can have nausea and vomiting. This is caused by long-term damage when the nerves cause the stomach not to function properly and the food sits in the stomach longer than it should. How is diabetes diagnosed? It's done by a simple blood test. There's a couple of different kinds of blood tests that people can use. One is a fasting blood sugar level. Current guidelines say that if it's higher than 126, then you have a diagnosis of diabetes. Also, there's a 3-month value that they can measure called the hemoglobin A1C. That doesn't require you to be fasting when you get your blood test done. And if it's higher than 6.4, you're said to have diabetes. Also, if you have a random blood sugar that's higher than 200, you probably have diabetes. So how do you treat diabetes? There's a lot of medications out there that can be used to treat diabetes. Just like with hypertension, if you start a medication, you don't want to stop it on your own. You always want to talk to your doctor before stopping diabetes medications. You might feel okay, but that doesn't mean you are okay. Just like hypertension, diabetes is a silent killer. Oftentimes you don't have any symptoms associated with it, and that's why people go years without being diagnosed. But the damage is still occurring even though you don't have that diagnosis. And so also you may feel better because you're on the medication, but if you stop the medication, your sugar levels probably will elevate. If you want to stop the medication, you always have to talk to your doctor and they can work with you to see if it's possible. Also, they'll be measuring your hemoglobin A1C, which is a 3-month measure of your sugars, and that lets them know if that number keeps falling and has come into the normal range. They might work with you on decreasing your medication and then seeing if they can stop it or not. Not everybody who has diabetes needs to be on insulin. There's a lot of new medications out there that people can use and try. Some people, however, do need to start with insulin if their sugar levels are high enough when they're diagnosed. That doesn't mean that they'll always be on insulin. It's possible for them to get onto oral medications in certain situations, such as changing their lifestyle, losing a lot of weight, increasing their activity. However, sometimes that's not the case. So always talk to your doctor and work with them about how much insulin you need, if you need insulin, and if you can come off of the insulin. Now let's talk about the things that you can do that are not related to medication. There's certain foods that make diabetes worse. What are those foods? Any guesses? I think everyone can probably agree that eating foods that are high in sugar will cause diabetes to be worse. So things like candy, chocolate, desserts like cakes and donuts and pies and sweets that are typical to your country of origin all have high sugar content and should be consumed minimally or as little as possible. It doesn't mean that you can't eat them ever. It should be done in moderation. There's also foods that, although we don't add sugar to them always, they already have sugars in them. They're called carbohydrates. So what are examples of carbohydrates? Examples are wheat and rice and potatoes, corn, beans, fruits and vegetables, and even dairy. So eating a lower carbohydrate diet or a complex carbohydrate diet can help. So eating brown rice instead of white rice, eating whole grains instead of white flour, wheat bread instead of white bread, eating fruit instead of candy and chocolate and man-made desserts. Other things that you can do with your diet would be eating a low-fat diet. Diabetes increases your risk of strokes and heart attacks, and having high cholesterol further increases that risk. And so having a low-fat diet can help with that. Baking or grilling your food instead of frying it. Limiting the potato chips and fried snacks that you eat. Eating skinless poultry and fish instead of red meat. Avoiding cream and butter. Using olive oil instead. Nuts are great, but in moderation. Too many nuts will cause you to gain weight. which will make your diabetes worse. So besides changing your diet, you can also start exercising. As you exercise, you will lose weight, and that will help your diabetes. Why is exercise helpful? Losing weight makes your body less insulin resistant. Your muscle takes in glucose when you exercise, and so that decreases the blood glucose level. Exercise increases your good cholesterol, and so it decreases your chances of heart attacks and strokes. Exercise helps decrease stress. The current recommendations are that you exercise 150 minutes every week. That's about 30 minutes 5 times a week of moderate exercise. Of course, you want to talk to your doctor before you start an exercise program, but even simple things like walking can be helpful in helping decrease your blood sugars. People who are overweight by exercising can often bring down their weight and actually control their diabetes just by diet and exercise at that point. Stopping smoking is helpful in your treatment of diabetes. So smokers are 30 to 40% more likely to develop diabetes. So the nicotine in cigarettes actually increases the glucose in your blood. As we talked about in the hypertension talk, smoking hardens your arteries. So anything that damages your arteries further will cause you to have more strokes and heart attacks. Decreasing your alcohol is important because alcohol increases the glucose in your blood as well. If you're overweight or obese, decreasing your weight will help treat your diabetes. Being overweight makes you insulin resistant. So the less insulin resistant you are, the more the insulin will work on the glucose in your blood vessels and bring it to the cells where it belongs. Decreasing the stress in your life can also be helpful. When our body is in a stressful state, our body releases hormones or chemicals that help us to fight the problem. And one of the effects of that is that we will have more glucose that stays in our blood supply because our body feels like we need to use that to combat the problem that we are encountering. Things that help with stress reduction are yoga, meditation, taking a walk, maybe calling a friend, enjoying a hobby. Now, something that you want to do every day if you have diabetes is to check your feet. Check the bottom of your feet to see if there are any cuts or ulcers or any sort of damage that needs to be fixed. Now, if you are young, you could probably just lift up your foot and take a look at it. But if you are older and you have a harder time doing that, or you're not as flexible, then you can actually put a mirror on the floor and then put your foot on top of it and just take a look in the mirror to see if there's any problems. Also, if you spread out your toes, you can see if there's any fungal infection or anything like that growing. If there is a fungal infection, that sometimes often looks like skin that's a little macerated, or just like it's a little wet and not intact in that area, that could be a sign that you have a fungal infection that needs to be treated before you develop an infection. You want to wash your feet and dry them even between the toes every day. You want to look for cracks, any signs of an infection or any sores, and also any fungal infections. You want to apply lotion to your feet every day, but do not apply it in between the toes. That just increases your chances of getting a fungal infection there. Check the bottom of your feet every day using the mirror, like we talked about. You want to look for dry, cracked skin, blisters, cuts, scratches, red areas, tenderness to touching, ingrown toenails, corns, calluses, sores. If you have any of those, you should just go see your doctor, because catching it early, like we talked about, will decrease your chances of needing an amputation. We've been talking about how to bring your blood sugar low, but let's also just talk about hypoglycemia, or when your blood sugar goes low. This can happen when you're exercising, when maybe you're watching your diet very carefully, but you're taking your medicine and because you've been doing all these things and losing weight, maybe you need less of that medicine. So people can experience hypoglycemia. Hypoglycemia is dangerous, so it's important to know the signs. Let's talk about what causes hypoglycemia. Being more active than usual, losing weight, missing a meal, changing when or how much you eat, taking your medicine at a different time than usual, drinking alcohol without eating. What are the signs of low blood sugar or hypoglycemia? sweating, hunger, nervousness, shakiness and weakness, headaches and dizziness, blurred vision, a fast heart rate, feeling anxious. If it gets really low, it can also change the way that you think, can put you into a coma or cause you to become unconscious, cause seizures, and even death. So it's always important to carry something with you in case you become hypoglycemic or you start to have a low blood sugar. So what you want to have is 15 grams of a simple carbohydrate or a quick acting carbohydrate. Examples of this would be 3 to 4 glucose tablets, 4 to 6 pieces of hard candy, 1 teaspoon of honey, and if you put that under your tongue, it absorbs faster. 1 tablespoon of sugar, so you can carry around sugar packets, half a cup or 4 ounces of fruit juice or soda or cola, not the diet kind. You should usually start to feel better within 15 minutes. If somebody does faint or become unconscious, they need to go to the doctor right away. Either call 911 if you're in a country where you can call an ambulance to take your loved one there, or take them there yourself if there's no availability of something like that. That is a life-threatening situation. If you do have a hypoglycemic episode, you should probably make an appointment to go see your doctor to see what's causing it if you aren't able to figure it out on your own. It's also probably just a good idea to let them know so that they can monitor it with you. I hope I answered most of your questions about diabetes. For more information about health and safety, continue to watch our Save Each One videos. And remember, none of this replaces the advice of your medical doctor.